Looking at your blood sugars can be good thing, bad thing, and it's a surprise. So, this May or so, I found that my hemoglobin A1C for the first time was 6.6%. Usually it was around 5.7. That came as a real surprise to myself. So basically, since last year, I've lost over 20 to 25 pounds, working on building some muscle. I use the Libre 2 device on 3 occasions. It's always falling off. And I'm learning how to use it better and to monitor my blood sugar. So the team is going to help me manage my blood sugar better and hopefully learn about your blood sugar a little bit more. Tell us more. And one thing I'm going to, before you get started, is that I can predict diabetes 20 to 30 years before you have it in many circumstances. How? If your triglyceride level is greater than 2 and your HDL cholesterol is less than 1, you have insulin resistance and you're on your pathway to diabetes. So 30 years ago, my triglycerides was greater than 2 and my HDL cholesterol was less than 1. So that tells me that I'm on a pathway to sugar diabetes. Also, you look at your family history. My brother has diabetes. My dad had diabetes. And so you can see if it's in your family, you're more likely to have this condition as well. There's multiple forms of diabetes. We're talking about type 2 diabetes predominantly at this stage of the game. So we're gonna learn what this CGM means and what's going on. Let's hear some more information.
Yeah, so what are CGMs? So CGM stands for continuous glucose monitoring. If you could go to the next slide. Yeah, so continuous glucose monitors, they provide a regular reading of blood glucose at regular time intervals, and they're highly suitable for individuals who are interested in keeping an eye on their blood glucose, which may include people like pre-diabetics, seniors, youth with type 1 diabetes, and individuals who dislike blood sugar, like the regular finger pricks involving needles.
Just backtrack one slide. So traditionally, when I first backtrack one more slide. Oh, this is just the finger one. Sorry, we don't have a finger one here. Never mind. So traditionally, when I first started, we actually tested in the lab, and then we tested urine for sugar, and then a big advance was these finger pricks, and now we have continuous monitoring. So we have multiple systems. Right now, some people will actually sell you a gadget on a watch that's supposed to tell your blood sugar. They don't work at this stage. So I'm hoping with infrared or different technologies, that technology may change right now, but this is what we have right now. And it's remarkable how you can actually know your blood sugar every moment of your life if you wanted to. I'm not sure we want to, but for some people, it's a good thing. Some people, it's a bad thing. So tell us more.
Okay, yeah, next slide, please. Okay, so continuous glucose monitors provide instant and accurate readings about glucose levels in the body, in addition to keeping track of how they change throughout the day. And because of this, they're highly useful to see trends in blood glucose and glucose tolerance, as well as the time spent within the targeted glucose range. Um, with this information, you can make better decisions about your lifestyle, diet, and medication that properly reflect the current blood glucose levels. And keep in mind that although CGMs are accurate, they need to be calibrated from time to time to maintain accuracy. Next slide. Yeah, so like Dr. Curnew was talking about, so comparing the traditional like blood glucose meters or glucometers to the CGMs. So this is just a simple diagram to show you how the CGM actually implants into your skin as opposed to the traditional blood glucose meter. And we can see that the CGMs, they measure blood glucose not from the blood itself, but they go into the skin and measure like the amount of glucose in your interstitial fluid, which is like the fluid surrounding your cells in the body. And CGM allows you to easily access glucose data over multiple hours, rather than pricking your finger multiple times a day with the traditional system to check your glucose. And glucose can like freely move from your blood vessels to interstitial fluid, which makes the CGM like a reasonable and like reliable alternative to measure glucose. Next slide, please. Okay. In terms of costs and practical considerations, for this webinar, we'll be focusing on like two of the main brands that you can find in Canada. So those include the Abbott Freestyle Libre 2 and 3, and there's also the Dexcom, and Dexcom has like models such as G6 or G7. In terms of, at least for Canada, the cost to implement and maintain a CGM system can be around $3,500 to $6,000 a year for a real-time CGM, and 2,000 to 3,000 for an intermittently scanned CGM. And we'll go into what the different types are of CGMs. And the costs vary, but the cost can vary depending on what kind of components you have in your system, how frequently the sensors need to be replaced, and other costs such as like antiseptic wipes to clean your skin and things like that. And for example, like CGM sensors might need to be replaced like every couple weeks. And yeah, and as for practical considerations, some parts require regular replacement in addition to like occasional like finger stick tests with the traditional glucose meters to verify their accuracy from time to time. And sensors usually last 1 to 2 weeks before needing to be replaced, but some may need to be reconnected or recalibrated sometimes if they're not working properly. And you also don't need a prescription. You can get it over the counter in Canada if you don't have insurance coverage. And you can either order it from the suppliers themselves or from a pharmacy that supplies it.
What's kind of interesting is that you can actually get insulin without a prescription, and you can actually get these monitors without a prescription. And what I will say is that for type 2 diabetes, the government of Ontario pays for the Libre 2 devices only for people on insulin therapy. And Dexcom is predominantly used for type 1 diabetes, but certainly there's different options available. And you don't have to use them continuously. So Libre 2 is about $90 for 2 weeks at a time or 15 days. And we'll learn more about this as time goes on. So I used it 3 times, and I learned a lot, and I continue to learn more about that. And one of the things is learning how to use it properly without having it fail. And so we'll learn more about that. Tell us more.
Okay. And I mentioned how Dexcom and the Abbott Freestyle Libre are like the main brands in Canada. But there's also another brand that's available in the US, not in Canada currently. It's called the Dexcom Stelo CGM. And this sensor is designed specifically more for people with type 2 diabetes who might not use like insulin treatments. The sensor lasts about 15 days at a time, and it costs 89 to 99, so US dollars for a pack of 2 sensors, and you would wear it back on the back of the arm, just like other CGMs.
So this is something that, again, we'll have to see how this flourishes in Canada. But I thought you said it's available, but the reader doesn't work. Is that right?
Yeah, so people who have tried it in Canada, at least from what I've read, they were able to actually buy the device, but they weren't able to access the app that's paired with it to get a reading of the results.
Yeah, I'm also told about, like, with the Libre 2 device, depending what country you buy on, it may not work in your country. So I think it's available in Europe. Let's say the Libre 2 devices, if you buy one, I don't think it works in Canada. But we'll have to check in a little bit more about that. So do you know anything about that at all? Maybe as we go along, so you guys can just get out the Google and find out if you buy a Libre 2 or different ones in different countries, will they work in Canada? I don't think so, but we'll take a look as we go to find a little bit more, because we're always learning. Tell us more.
Yeah, for sure. And in terms of financial coverage for CGMs, many private insurance providers do cover CGM systems, but in terms of public coverage, at least in Ontario, some Ontarians may be eligible if they're eligible for the Ontario Disability Support Program or the non-insured health benefits program for First Nations or Inuit individuals. And for eligible individuals with type 1 diabetes, there's also funding available under the Assistive Devices Program for those individuals. Next slide, please.
So in Ontario, the way my understanding is that type 1 diabetes, that's funded. Type 2 diabetes, it's only for those on insulin therapy at this stage. Obviously, but I think these devices are so valuable to be using on an intermittent basis. So spending $90 a few times a year to give you good insight on, what your sugar metabolism can add ways of fine-tuning how you handle different carbohydrates. I'm going to show a lot of examples of that. I'm quite amazed at how we're all quite different. And so we'll keep learning. Tell us more.
Yeah, okay. So now we can move on to going over the types of CGMs. So next slide. Yeah, so like I kind of mentioned this earlier, but the main types of CGMs are real-time CGMs and intermittently scanned CGMs. So for the real-time CGMs, they consist of a sensor, transmitter, and a receiver or your smartphone device. So the sensor is a tiny wire and it's inserted just under the skin and it's measuring the glucose in the interstitial fluid, like I said, and to estimate the overall glucose levels in the blood. And the transmitter just attaches to the sensor and wirelessly sends the continuous glucose data to a receiver. So that could be your smartphone device, which is connected to a CGM app, allowing you to monitor your levels in real time. And you can set alarms and alerts to manage your glucose levels more effectively. Next slide. And the other type is intermittently scanned CGMs, also called flash glucose monitoring. So like the Freestyle Libre device, at least the Freestyle Libre 2 is an example of this, because I believe you have to scan every 8 hours or so in order for it to continuously monitor your glucose levels. But the main difference is that the transmitter is integrated into the sensor unit itself, and only when this sensor is scanned does the glucose data get sent to the receiver, as opposed to the real-time one continuously sending the glucose levels. And while they don't provide real-time alerts, they still offer insights into your glucose trends.
So with the Libre 2 device, you can actually have continuous monitoring, but you have to scan, you said every 8 hours.
Yeah.
And but and you can go back and look at some of these things later. So that's kind of interesting. Keep telling us more.
Yeah, next slide. Okay, yeah, and in considering the accuracy of CGMs, there are some factors that can cause inaccuracies. So one of the things is that since CGMs measure like your interstitial fluid rather than the blood glucose directly, there could be a little bit of lag between the blood glucose and versus your interstitial glucose, especially during times of rapid changes in glucose. Another thing is that readings can vary by device, and there could be occasional discrepancies, which may require like you to do like a finger test with the glucometer to confirm. And there's also other factors that could affect accuracy. So it usually if you compress the device, like if you're lying on the sensor in bed, usually that will tend to lower your reading to give you kind of a compression low. And things like hydration or other medications paired with using the device can lead to inaccuracies. So things like Tylenol and salicylic acid have been found to kind of distort the results before. Yeah, next slide, please. And yeah, so considering these inaccuracies and like things that can go wrong with CGMs, the Freestyle Libre website has some tips on how to better wear the sensor to kind of prevent it from falling off. So they recommend to first like wash the area that you're going to apply it to with a soap or like a wipe or something like that. So use an alcohol wipe to remove any oil on the skin to try to prevent it from sliding off, and also to make sure it fully dries before applying the sensor. Um, and also try to wear loose clothing when you put it on, and be careful of doorways and showering, because those can kind of interfere with the sensor placement. And also you can use an adhesive to put it over the sensor. So one example is Tegaderm, as in like an extra adhesive to keep it on. And another thing is that if you put too much pressure on the sensor accidentally when you're sleeping, there's times when it might recalibrate automatically. But if there's too much pressure that's put on the sensor, it will sometimes say that you need to rescan it to recalibrate it, or that you might need to replace the sensor if there's too much pressure on it. So that at least that's for the Freestyle Libre device. But yeah, those are some general tips.
So it's really important to wash it, clean it, dry it. And I think putting on something like Tegaderm afterwards is really important if you run an active lifestyle. Yeah, they do fall off. They can not. I knocked one off going into my car, but as I opened the car door, I banged it on the my on there. That one came off. Other times, stopped working in the shower. Another time is that just we'll talk more about this. So basically, I'm learning to use it, and we have to put over the tricep area. You can see this area too as well for it to work the best there. And um, keep telling us, keep teaching us.
Yeah, next slide, please.
And also, just want to add before I move on as well, I just looked at the Freestyle Libre device website, and it officially said, and I quote, "No, the Freestyle Libre system has specific regulatory requirements that often vary by country. Thus, readers, Libre readers or the Freestyle Link app may not be compatible in another country. So just be mindful of that. Good to mention as well before we move on from the Libre device.
So if you buy one in Europe, it won't work on a Canadian.
Yeah.
Is that right? Okay.
It cannot work. So it may work depending on the requirements of that country, but it seems like there's differences, as you said before, between countries. Absolutely.
Oh, it's kind of interesting. We'll show the 1-800 number. So if you go between Canada, US, different countries, what you should do, call other decks, call an Abbott. That's fine. We'll have to find out. And maybe we'll get if one of you guys wants to call the 1-800 number for Abbott there while we're here right now, that would be find out, see if they're still open and find out if I'm traveling to Europe, whatever. What does all that mean if I go to the States or something, and does that work or not? I just we'll try to find that out, and then we'll make some phone calls along the way.
Yeah, for sure. I know these numbers are for Canada, but there are numbers for other countries as well.
So
Yeah, but in the meantime, we can move on to how to actually interpret and read your CGM data. Next slide, please. Okay, so in terms of how like the CGMs get read and how the information gets transmitted to a receiver, so basically the device that receives that information.
Just backtrack one slide there. So this is kind of interesting over here. I like millimoles. So you have milligrams per deciliter, millimoles over here. You can see that your blood sugar is varying, and you can see different spikes corresponding to different eating. For instance, first thing in the morning, you get a surge of cortisol that can bring it up. For instance, you have poor sleep, that might lead to higher amount, depending what you eat and how you eat. You can see different surges. So everybody's a little bit different, and you can actually see how you can impact on your diet. You can see that the most important thing to control blood sugar is to control your weight. Certainly composition of diet is important, exercise is important, but if you weigh too much, you often develop insulin resistance, and you are accelerating destruction of your insulin producing cells called beta cells. So this is really, really important. It's a long process, and diabetes has more than tripled since I started practice. And we're going to learn that somewhere between a half to 2/3 of North Americans, adults, have insulin resistance or on a pathway to diabetes. So that's a lot of people. Yeah, if I remember correctly, I think we weigh on average 10 pounds more than we did a couple of decades ago. Keep telling us more.
Yeah, so each CGM that you get, whether you get the Freestyle Libre or the Dexcom device, so each system has its own app. So if you get the Freestyle Libre 3 device, you would get the specific app for that. And the apps will tell you things like your glucose trends, what your glucose levels is, and things like HbA1c and all that you can see from your app, and you can see a history as well over hours or days or months. Next slide. Yeah, and one thing with the Freestyle Libre 2 is that you can actually go to LibreView.com if you want to see like a comprehensive glucose data history. So that will tell you like things like your time and range for glucose, which we'll talk more about, and like your glucose levels over various months, and that'll basically track like your full history of glucose scanning, whereas the app is a little bit more limited and might track only like the past 90 days, for example. Next slide. Okay, and here's Dr. Curnew's CGM data on LibreView, which he kindly let us share in this webinar. So you can see on the LibreView site that on the right, it will show your time and range. So basically, it will show you different ranges of glucose. So it will say the target range is around 3 to 10 millimoles per liter, and you can also customize what you want your target range to be. And it will say like very high or very high glucose and also low. So it will tell you what percent of the time your glucose levels are in certain ranges, and that can help you kind of get an estimate about like if your glucose levels are in a healthy range or not. And on the left, it'll also tell you how long your readings for are in that range, your average glucose and things like that.
So one of the things that happened to me, you can see I'm in the very low range. That's when it actually failed. So after I took a shower, I maybe lied in bed. I probably lied on it, and so it gave me a false low reading at one time. So but it's quite amazing how you can see on so one way to lower your blood sugar, what I did to lower after a meal is that I go for a walk, and that would help lower my blood sugar. Or I would change the composition of my diet, and we'll talk about that too as well. I've been a nighttime eater, so one of the things that what I've given up doing is that after I go to bed, which is somewhere between 10 and midnight, I try not to eat or drink, or not try to say not try to eat till the next day after noontime. So I'm trying to give myself at least 12 hours where I'm giving intermittent time restricted eating, and I'm going to try to change that window. But it would be traditionally for me to get up at 2 o'clock in the morning, go to the bathroom and have a snack, and then burp and fall back to sleep. I've given that up. And one thing I've noticed, my energy level is dramatically better. So what is that what I like to do now is I'm going to try to stop eating a couple hours before I go to bed. I have difficulty with that. I still haven't mastered that. And looking at my blood sugars help influence that message. And then in the morning, I love to go to the gym or do a workout. And basically, I will have some coffee with usually skim milk. Now, I used to put oat milk in my coffee until I found out that oat milk is relatively high in simple sugar. And so I'm just drinking coffee, and I try not to eat till the afternoon. And I feel so much more energized. In fact, this weekend was a really fun weekend for me because both Saturday and Sunday I went plane gliding, and so I didn't get home till about 5 o'clock. So I didn't really have anything to I didn't have anything to eat, and I felt more energized, more refreshed. And I find at the end of the day, it's hard for me to restrict my calories. So I'm still working at that, but it's made a difference. And so you can see some numbers. Do you want any comments at all?
I
Morgan,
have
one of
some
these numbers?
comments. I have two
Yeah, go ahead
questions
there.
actually. Not
Go
comments,
ahead.
more questions. So 17% of the time hypoglycemic. I wonder, is that normal? And what do you think the cause of that is? What's the
Yeah.
explanation behind that?
So actually, it wasn't that low. It failed. So I
Oh,
was
is that
actually
why?
lying.
Okay.
Yeah. So I think there was a failure of the device in part.
Yeah,
And so it's actually, so because one of the things that if your blood sugar is very low and you feel good, there could be something wrong, and that's where these things have problems with low blood sugar. They sometimes make mistakes,
I see.
and they're make more mistakes at the low compared to the highs.
Fair enough. I'll actually look into this to see what the normal time is into this at this very low
It's
level.
also rate of rise too as well. It's important, and you'll see some ups and downs, some spikes. So
Yeah,
we'll show you
yeah.
some graphs of that. Anything else you want to add to that? Oh, go ahead, Morgan. Tell us more. Okay, let's take a look.
Yeah, we can take a look at his so these are 2 days. So these are 2 days in September, where he had the freestyle Libre on. But we can see that It ranges from about like 5.9 to about, say, in the nines. So it does vary throughout the day, and you can see like the little spikes, which may indicate like when he may have had some food or whether there was any other stressful events that may have brought it up a little bit. And there's also in red, so the red will highlight when it's considered like a hypoglycemic event. So that would be like a glucose level of lower than 3.8 or lower in millimoles per liter. And like Dr. Curnew said, it looks like it's about around like 1 a.m. or like 12 a.m. So that might indicate like he was in bed and may have been too much compression that led to the lower levels. But yeah, any other comments?
You can see some of those values at 9.5 and so those are we'll talk about some of these things. So just remember that 9.5, 8.1, those are some spikes there. You can see some averages up and down. And this is actually after I've been really working hard at for a number of months. I'm not sure if we have any continuous monitoring on the first one I had. Do we have any ones, those ones at all, Morgan, or just this one?
It's just these ones.
Okay, we'll show you more as time goes on. Go ahead, tell us more. Go ahead. Yeah, go ahead.
Okay, so moving on to some of these CGM metrics here. So we'll start off with the glucose levels. So essentially what this is a real-time measurement of glucose in your interstitial fluid. And it's recorded every few minutes by your CGMs. So monitors it and it sort of graphs it out for you. So, and then you've got trends as well, which are like directional indicators. So upwards or downwards arrows showing whether glucose is rising, falling, stable, and allows for prediction of either hypo or hyperglycemia. But then you've also got patterns. CGMs capture these daily fluctuations in glucose and help you identify either recurring spikes or recurring lows, and is helpful for adjusting your lifestyle or medication. Next is time in range. So what this is essentially you've got your target range for diabetics at typically 70 to 180 milligrams per deciliter.
Okay, so we actually use millimoles. So we'll try to just always use millimoles if we can. Okay, so if you can convert that, that's actually kind of important. So milligrams per deciliter is US units, and it's roughly a factor of 20 to get to millimoles. So so a lot of these things are US papers and things of that nature. We'll show you some. We don't want to confuse people talking about milligrams per deciliter. We're in the wrong country.
Exactly. So we've got the millimoles conversion on the right over there. It's just a chart. So just to convert that over, it would be about 3.9 to about 10 millimoles per liter. And that would be the target range for diabetics, indicating effective glucose control. So spending a high percentage of time within this range is associated with reduced complication risks. So showing that having that time in range in the middle here is showing like the amount of time you're within this range, above or below. It's just really helpful to see. Additionally, you've got highs, which are extended periods above the range, which could increase the risk of hyperglycemia-related complications. And then lows, which is the time spent below 3.9 millimoles per liter, is concerning, especially for diabetics, because it indicates hypoglycemia and has potential for adverse effects. So moving on now to the Freestyle Libre 3. Essentially, the data is up to a max of the past 90 days, which is shown on the app. And the reading on the phone is connected to the website so that you can actually access the information, which is the exact same information, both on your phone and on the website. And on the slide here, we just have an example of what you can see on the app with a very similar display as the previous app. So glucose is shown for the past 12 hours or the past 8 hours on the Libre 2. And you can also add a note about your diet, activity, or anything of interest to identify trends between daily activities and blood sugar. So the Freestyle Libre devices record blood sugar throughout a 24-hour window as long as they are scanned once every 8 hours. And as long as you scan it, the app will show your current blood sugar in the past 8 hours, and predicted glucose trend. Okay, moving on now. The oral glucose tolerance test measures blood sugar 2 hours after consuming 75 grams of pure glucose, and essentially what's important here is that CGMs alone cannot be used to diagnose diabetes. So one may be diagnosed with diabetes if their fasting glucose is above 7 millimoles per liter, or if they have above 200 on the oral glucose tolerance test.
So if you look at, so that's kind of important to understand this over here. So traditionally, type 2 diabetes is a diagnosis of a fasting blood sugar greater than 7 or a 2 hour after a sugar load over 11.1. So that's the traditional way we use that. And we now change that. Or a hemoglobin A1C of 6.5% or greater. Hemoglobin A1C is the glycosylated, sugar gets chemically transformed. A normal hemoglobin A1C for a young person is between 5.5 or so. And you can actually see, if you go in the bottom, you can see that normal hemoglobin A1C is 5.7%. Or a fasting blood sugar is less than 5.6, or the 2 hour PC is less than 7.8. And then you can see how that changes between diabetes, where the definition of diabetes is a hemoglobin A1C greater than 6.5% or a fasting blood sugar greater than 7%. And so these are, you should actually take a picture of this and look at some of these numbers here. It is a little bit confusing, but yeah, you learn it pretty quickly. Tell us more about these sorts of things.
Okay, moving on now, we've got the A1C to conversion here. So what we can do here with this chart is, if you look at each row of 3, it's a conversion between HbA1c and glucose in both milligrams per deciliter as well as millimoles per liter. So you've got...
So this is something, I'll let you go into this later. The mistake people say, what is my blood sugar? So if I say your hemoglobin A1C is 6.6%, what's the average blood sugar? 8.8. Okay, it's really important. Is that really important to say in a sense? So if you show that table there, hemoglobin A1C 6.6%, you're diabetic, but your average blood sugar, if you get next table, please go back for more, is 8.8%. You're not measuring apples to apples. Glycosylated hemoglobin is your red cells. Your red cells are in your bloodstream for 120 days. If the blood sugar gets elevated, they get chemically transformed called glycosylation. And glycosylation is a wrinkly process of your skin and different properties as well, but it's also a transformation of your red cells. Now, your glycosylated hemoglobin is a good reflection of blood sugar control, provided you have normal hemoglobin, normal red cell counts. So if you have chronic renal failure and your hemoglobin is low, or you have something called thalassemia minor or major, or sickle cell anemia, you have abnormal hemoglobin, then you cannot use these tests reliably to look at this. So this assumes that your hemoglobin is relatively normal. To start off with. And I think it's really important. So this is actually a key factor in this over here. So again, if your hemoglobin A1C is 7.8%, oh, that's great. My blood sugar is 7.8%. No, the average blood sugar, if you just show, is 11.2%. Brad, can you just show that again? So if my glycosylated hemoglobin, why are you changing slides? Go back to the slide. If you go on this table here, is that see the hemoglobin A1C is 7.8%? Right. Then if you go below there, the average blood sugar is 11.2. Okay. That's an important consideration about that. So I want people to understand that. And so you can say, oh, my blood sugar is 7.8. No, it's not 7.8. Is that if you say is my average blood sugar is 7.2%. Your hemoglobin A1C is 5.8%. So these are numbers to realize and to be different. And I think a lot of people just don't understand that. Keep telling us more. I just want people to understand this concept. It's really important. I can never remember all the numbers. I always add a couple points above the hemoglobin A1C, but this is a much more precise thing. So people should just take tables and look at these things and These are important numbers over here.
All right, perfect. And as you can see, the colors just represent your diabetic sort of range. Okay, moving on now to normal glucose response after meal. So essentially for non-diabetics, it's expected that your post-meal glucose rises moderately and peaks around 1 to 1.5 hours after eating, generally staying under 7.8 millimoles per liter. And then your glucose returns to baseline within 2 to 3 hours. For diabetics, your post-meal glucose spikes are often higher and more prolonged, and levels may exceed 7.8 millimoles per liter and take longer to return to baseline due to insulin resistance and lack of insulin production. And then after that, we've also got an example data here with different foods. So as you can see, next slide. As you can see, like salty cookies and cappuccinos, once your first meal, you got a big insulin spike then. And then again, with the salty cookies, you got another spike there at 12 p.m. Bunch of donuts, potatoes, mandels, and you got another spike around 6 p.m. over there. And then with the chocolate, you see another little spike after you take that, and then it rises, it goes back to normal, back to baseline. So when you're eating, like you get a little bit of spike, but as you can see with the cappuccino, there's really not much there, so you don't really get a spike there. And
so what's happened in North America, if this is what your diet is, if I go to, we've done very good at feeding people really delicious food that is filled with sugar, simple carbohydrates, processing that's relatively cheap. And so what we're doing is we're killing ourselves. The current North American diet, where 70% of us are eating 70% of our calories from processed food, is destructive and it's destroying. So we already made 2/3 of North Americans insulin resistant, developing diabetes, with about 80% of the people I see in my clinic are overweight. Now, the ideal body mass index is around 22, 23. Yes, you need to adjust for body composition, but we really have to think about what do you want to do at this point in time with your life. And these machines give you really good instant feedback on how you're doing at different phases of life. And go back one slide, you can see that a normal person on the bottom has a shorter rise, and it comes down much more quicker, where a diabetic will go higher and stay elevated longer for that period of time. And so one of the things that I done is changing my window of eating to try to prevent some of these spikes in that circumstance. I hope you're doing the same too as well.
all right, so as we age, this chart really just goes into details about some of the goals of before meals or fasting levels, as well as after meal levels. So you can see children and teen are their own range between about 5 to 7 millimoles per liter. Adults are a little bit lower, but still maintain that 7.2 end limit there. And then for pregnancy, that limit goes down. So it's typical that with pregnancy, your fasting glucose levels are lower. And then again, with elderly individuals here, you can see this range just gets a lot bigger. So 4.4 all the way to 10. And without diabetes, as always, it's just below 5.6 millimoles a liter.
So you can see as we get older, your pancreas is wearing out. And we start off in saying is that this, the body after the age of 30 faces a downhill course in many processes. Your body wears out, and you can see that this happening. And most of this is you're totally unaware this is happening. If your triglyceride is over 2 and your HDL cholesterol is less than 1, you are developing diabetes. If you have gestational diabetes, after the pregnancy is over, the sugar corrects itself, you will have more health problems. You will have diabetes later in life with a very high probability. So it gives you the opportunity to start working at it. So I see so many people saying, I basically I made my diabetes go away. you can't make it go away. You can put it into remission. And it will, and this magic of 20 to 30 pound weight reduction is what's required to put your diabetes into remission for a period of a number of years. Remember, the time you make the diagnosis of type 2 diabetes in most individuals, half the cells that make insulin are dead. I'll repeat myself. By the time you make the diagnosis of type 2 diabetes, half the cells that make insulin are dead, and the rest are working overtime. Now, can you regenerate? The answer is maybe, maybe not. But I can sure make better. And you know, if my tires are underinflated, putting extra load on my car is going to wear out my tires quicker. So so this business of weight control is the number one factor, should be a priority, and to keep it off. It's hard. I get it. And you know, when 80% of people in North America are walking around overweight, guess what? You're probably going to develop a very high incidence of diabetes, and this is what's happening. So I'm working very hard. I got myself down 25 pounds, still working at it, and you know, and I hope you do too as well. So keep telling us more.
Yeah, so this
Just want to
the-
show this more. I can go ahead since Dr. Curnew was
Yeah.
talking about the importance of weight loss. Go ahead. Thank you so much.
Yeah, exactly. Yeah, so what Rad pulled up was just this direct clinical trial. So it studied whether adults with type 2 diabetes could put their diabetes into remission through a weight management program like Dr. Curnew was talking about. So they took 300 people with type 2 diabetes and they split them up into two groups. So half of them did the control, which was just no intervention of like a weight loss program, and the other half did do like a weight management program. So that consisted of like a lower calorie diet, working with like a nurse or a nutritionist to kind of maintain that weight loss. And it was found that around 3/4 of people who lost around 10 kilograms after a year through this weight loss program achieved diabetes remission. So it was found that on average they lost 10 kilograms through the weight loss, and 3/4 of that were able to put their diabetes in remission, which is really notable, especially considering how the other group only lost around 1 kilogram on average. It is notable that like there was some weight regain after the trial, but it was found that 9 out of 10 people who did lose 15 kilograms or more did get their diabetes into remission. So it really just shows that the more weight that you lose, the more likely that you are to put your diabetes into remission.
So this is what I'm doing. I'm down 26 pounds, and I'm trying to put my diabetes into remission. Now, they screen hundreds to thousands of patients to find about 300 patients. And it's not seeing the dietitian that's important. It's basically because most people who go and see a dietitian don't change their diet very much, don't lose very much weight. It's been shown that the people who pay to see a dietitian or to means that they're much more invested. So I am extremely invested in my health. What I'm saddened to see is that I'm too tired. I'm tired at the end of the day. I don't have the energy. There's other priorities. Well, I'm making my health a priority because for every year you have diabetes, you're 40% more likely to have a bad outcome in that year, 40% higher, and losing 10 to 15 years of quality of life with blindness, kidney failure, heart disease, and stroke, Alzheimer's disease. The list goes on and on. I'm going to work my butt off to try to make this happen. So, and my supports are my family, myself, all you young people that keep encouraging me, that climb the CN Tower, lifting weights. I think Darren, my squash buddy, who beats the shit out of me at squash and then beats the shit out of me of exercise. And right now I'm having problems with my hip. I pulled some things, but I'll get back to this. And there's a second trial called the Broad trial that showed this too as well. So this magical thing about sending me to a dietitian is totally useless for most people because they don't really make the necessary changes. We have, 30 videos that tell you exactly what to do if you want to do it. So I need to be with groups of other people. I enjoy our Tuesday sessions and our Wednesday sessions. Our Tuesdays is concentrating on weight loss, and the group is such a wonderful group of people. We see people that have lost 75 pounds, see people who gained 10 pounds, but that conversation, that support is wonderful. Same thing on Wednesdays with mindfulness and meditation and exercise. The sad part is that very few of you are, or the patients I'm involved with, are willing or have the time or the energy to invest in their health. So if you'd rather go blind, kidney failure, congestive heart failure, poor quality of life, keep doing what you're doing. It's hard work. And there's times in their life where life gets in the way. I get it. There's so many different things that are happening, sick family members, other responsibilities, but make it a responsibility to yourself, because the science is the science. And if you're waiting for somebody else to do it, it's not going to work. If we can help you and you want to put the time and effort in, then let's do it. Tell us more.
Okay, so now we're gonna be talking a bit more about blood sugar spikes. So to do this, we're gonna introduce you a little case study. So this is Bob. He's a healthy 25-year-old male, no history of diabetes or other cardiac conditions. His BMI is in like a healthy range for his age and sex, and he's physically active, so you wouldn't expect any glucose intolerance or things like that. But one day, Bob finds that his blood sugar has risen after a meal of over 2.2 millimoles per liter. And this has never happened before, so he's concerned. So the question we want to explore, is this something he should be concerned about? Okay, so this is a study done, and it was looking at 24 healthy males and females, and it was looking at, it was using the oral glucose tolerance test, so giving them a bunch of like glucose to ingest and to examine how much glucose increase there was. And it was found that like on average, the healthy individuals increased their glucose level by about 2.2 to 2.8 millimoles per liter. And there was a peak glucose of around 6.6 to 7.3 millimoles per liter. But what we really want to highlight with this slide is that a rise of 2.2 to 2.8 is considered a generally normal or average level, because in these healthy, like 25-year-old or so individuals, if they have an average increase of this, then saying like things like there are a lot of like myths out there that say that spikes of say like 2 to 3 millimoles per liter after say like a big meal are harmful and are dangerous. But in reality, there isn't a lot of evidence to say that that is necessarily true. So yeah, next slide, please. So in terms of answering our question, I would say that Bob doesn't need to worry too much about his glucose rising by around 2.2 millimoles per liter, as long as like these spikes don't occur frequently and only last for brief periods of time. And we'll talk about a little bit more about how long this spike lasts and why that's important. But this diagram in the middle of the slide is showing that showing blood sugar spikes, and it shows that for normal or like healthy individuals without glucose intolerance, usually their glucose level will be in the range of 3.9 to 7.8 millimoles per liter, so 93 to 99% of the time. And sometimes, say you eat a big meal that's really carb heavy, your glucose may spike to 7.8 to 10. But the thing is, in these individuals, usually this only lasts for very briefly, so maybe like an hour. So only 0 to 4% of their day is spent in this range. And it was actually found that in normal or healthy individuals, those individuals will never have a glucose level of around 10 millimoles per liter. So if we go back to a 2 to 3 millimole per liter rise, then comparatively, as long as we're not reaching like 10 millimoles per liter of glucose, then it's kind of considered a normal or nothing to be too concerned about. Yeah, and so considering that like if you rise 2 to 3 millimoles per liter after a meal is normal, So what can be considered like a concerning or a dangerous spike? Well, a lot of research around blood sugar spikes doesn't really give very like clear evidence, and it could vary. But according to Dr. Mario Kratz, who is a diabetes and obesity researcher, he says that frequent glucose spikes of above 10 millimoles per liter may increase your risk of chronic disease. So this image is showing three groups of people. So it's showing diabetes, normal individuals, so non-diabetes, but who frequently have spikes of over 10 millimoles per liter. And then the right is showing normal individuals who don't spike to 10 millimoles per liter. And it was found, and like Dr. Kratz says, that for people with diabetes, they have a strongly elevated risk of chronic disease. And comparatively, normal individuals who do spike above 10 millimoles per liter do have or have found to have an elevated risk of chronic disease, such as cancer, cardiovascular diseases, kidney diseases, even if they have the same fasting glucose compared to the normal glucose group. So basically, the takeaway of the slide is that you kind of want to avoid having a glucose spike to above 10 millimolars per liter.
Well, this is actually wonderful data. And how do you know what your blood sugar pattern is unless you measure it? And so I would encourage people to use it, let's say a Libre 2 device, periodically. It will cost around, $90. And one of the things for seniors at Shoppers, you can get a 20% discount on on Thursday, sorry. And you can actually measure this periodically. You don't need a prescription to have this done. And certainly you can learn. You can see on the far left, you can see a diabetic. You can see on the far right, a normal person, and you can see someone who is developing insulin resistant, who's in the process of developing diabetes. And I kind of wish I did this 10 years ago, and not find out by surprise what my blood sugar was. I've been following my hemoglobin A1C for a long time, which is wonderful. It's been stable around 5.7%, and all of a sudden it's jumped up. So right now I'm going to try to figure out what to do. This is where my process of measuring at this point in time. And I used 3 Libre devices so far, and all of them have had some failures. So I'm regrouping. We called the 1-800 number today, and they actually gave us some advice, and they're going to replace the ones that malfunction. Is it myself? It's partially yes. Is it the technology? Yes. And so I found that to be a very, very useful support. I know Morgan was there with me. Now I needed Morgan to help me read the meters and get to the right pages and stuff like that and find things. I'm not as computer smart as all you young people. So find a young person, call the support, play around with this. This is actually important information, and you don't want to wait till your car has a flat tire before you do something about it. So you want to work on this. So we learned what a normal person is. Let's see what tells about Joe.
All right, so essentially what's going on with Joe here is she is 70 years old. She has type 2 diabetes, hypertension, BMI of 30, and a sedentary lifestyle. And essentially, risk factors for insulin resistance, in addition to type 2 diabetes, is being above 45 years old, obesity, being not physically active, and hypertension. So she's got all of the above. Moving on to Joe's CGM data. She's got fasting glucose levels of 7.2 to 8.3 millimoles a liter. And what you typically want here is to have the normal fasting range of about 3.9 to 5.6 millimoles a liter, but she's well above that. Her after meal glucose spikes. So after meals, her glucose rises sharply to 11.1 to 12.2 millimoles a liter and remains elevated for 3+ hours before returning to baseline. So that's a pretty long time. Her time in range, Joe spends approximately 40% of her day within the target glucose range of 3.9 to 10 millimoles a liter because she's above 65 years old, which is below the recommended 70+% time in range for individuals with type 2 diabetes. So she's spending a lot less time than she should be. within that range, that healthy range.
So if you look at Joe, look at her body composition, is that I think we all know lots of Joes or Franks and people of that nature, is that that belly fat translates to insulin resistance. If you get fat in your liver and your pancreas, it's deadly. Fat's not supposed to be stored in those organs, and they destroy those organs. So I know she's smiling, but I'm crying when I see people like this, is that I know what's going to happen. She's going to have more cancers, more dementia, more Alzheimer's disease, more atrial fibrillation, more joint problems, more chronic renal failure, more eye problems, more blindness, more heart attacks, more strokes. And we're supposed to love ourselves. Love yourselves, but love less of yourself, and really work hard to change yourself before it's too late. If you have a tire that's deflated, you do something about this. When we're looking at our bodies right now, is that we've gotten used to looking at an entire population that's in big trouble. And again, we can blame the food industry and saying that they're feeding us really tasty food as cheaply as they possibly can, and we're buying it. And is that the food industry, or is that our fault for just accepting these types of foods and things of that nature? I'm guilty as charged. I waited too long to treat myself, and I thought I was doing okay. So please work on it. Again, starting the age of 30 and downwards or upwards, things are going to start to age and things of that nature as well. So keep telling us more. Let's get Joe to be 20 to 30 pounds lighter and really make a huge impact on her overall health. Tell us more.
Okay, so seems like we skipped a couple slides, but
That's what. Do you want me to go back, or do you want to? Would you like to cover this one? Sure.
Go
ahead.
Go from here. Yeah.
Okay, contributing factors to Joe's insulin resistance are her obesity. So her BMI of, I believe, 30 classifies her as obese, which is a major risk factor for insulin resistance. Additionally, hypertension is high blood pressure, which is commonly associated. Okay. Normally, if you are fully glucose tolerant, your blood sugar levels will return to baseline about 2 hours after starting. Okay. Elevated fasting glucose. So the consistently high morning glucose levels suggest the presence of the dawn effect, where early morning hormonal changes cause glucose elevations. So this effect is often more pronounced in individuals with diabetes. Additionally, prolonged postprandial hyperglycemia is the sustained and significant glucose spikes after a meal, which indicate Joe's body is struggling to manage carbohydrate intake effectively, likely due to insulin resistance. And then the low time in range means that Joe's risk for diabetes-related complications are up because she doesn't spend enough time within that safe target range. Okay, next slide. Normally, if you are fully glucose tolerant, your blood sugar levels will return to baseline about 2 hours after starting a meal. However, Joe's levels were still elevated 3 hours after starting a meal. So if your sugar levels are still above baseline after those 2 hours, this may indicate that you are glucose intolerant to some degree and could be a result of insulin resistance. And to tackle these insulin resistance and glucose levels, some recommendations that we have are dietary adjustments. So incorporating a balanced diet rich in fiber and lean proteins while reducing high glycemic index carbs to mitigate post-meal glucose spikes. Additionally, physical activity, such as regular exercise and brisk walking for only 30 minutes daily, can enhance insulin sensitivity and aid in weight management. Additionally, medication review. So healthcare providers can assess your current diabetes and hypertension medications, ensuring optimal dosing and effectiveness. And stress management. So stress reduction techniques such as mindfulness or yoga can help with blood glucose because stress actually adversely affects blood glucose levels.
Okay, so in terms of some other advice on how to limit glucose spikes, this infographic by Nourish Science is showing some easy ways to lower your glucose spikes. without really reducing how much carbs you're actually eating. So the first tip is to lower the amount of foods that have a high glycemic index. So the glycemic index is basically like a number or value that tells you how much a certain food will like spike or increase your blood sugar. So you want to give preference to foods that have a glycemic index of less than 60. So things like, say, like white rice might have a higher glycemic index, and that might be something you want to avoid. The second tip is also to eat starchy foods after you refrigerate them. So if you say you make like potatoes, if you want to lower the effect that the potatoes have on your sugar spike, then you can actually put in the fridge and then reheat them, and then that that helps them to kind of convert it to a form that it's that lowers your sugar less. Another tip is to kind of have a source of protein, fats, or vegetables alongside the carbs, and also you can eat some vegetables before starting to eat the carbs, and that can also contribute and help you. And another thing is actually having some sort of vinegar can also help. So that doesn't just mean like drinking a bottle of white vinegar, but if you enjoy like a vinaigrette in your salad or something, that could be something to just like help. And it's really an easy thing to do. And the fifth tip is use the second meal effect. So basically that is just something that states that if you have a low carb meal for lunch, and if you have like a high carb meal for dinner, having the low carb lunch can actually increase the response that your sugar spike has to the dinner. Essentially, when you have a more of a balance, so if you have like a medium amount of carbs for lunch and dinner, then your body is kind of primed from lunch to help release more insulin, release more preformed insulin for dinner. So essentially, the tip is just not to alternate between low and high carb meals, but to kind of have a mix of both. And also go on a walk after meals for, say, like 15 to 30 minutes. That can also help.
You know, what's funny is that we all fall apart, and my weakness is that you're more insulin sensitive in the morning time. So the ideal window of eating for many people will be from about 8 in the morning till about 4 in the afternoon. I find that a challenge to do because I'm always hungry at nighttime. And what I should do, and I don't do this consistently, I'm guilty as charged, is after I usually eat late at night, and I should go for a walk afterwards. But once you get home, it's too cozy and don't want to go back out and things that nature. So you remind me I need to make some further changes. But I have made some changes. I'm still a work in progress. And, I'm not getting angry at myself for being not successful at everything I want to do, but I'm just going with the flow and surrounding myself with more positivity, more positive people. So I will stress that our Tuesday groups and Wednesday groups for an hour each night will do a lot of good finding other people from your family, friends, neighbors to do something. And so I like balsamic vinegar, but that's not actually the best vinegar because it has too much sugar in it. So, just any vinegar would be a better choice to use. Go back that one slide, please, for a sec. Is that really all these white sugars, white flours are really important. And there's really a lot of good data that shows if, this is prior to medication. We haven't talked about medication such as Ozempic or Wegovy that have great impact on changing the landscape of weight management. It takes the conversation away from food because I'm always hungry. I'm searching for food. But it's been shown that people are not prepared to do. You don't lose much weight by exercise. It helps maintain the weight, and you need to consider 60 to 90 minutes of activity most days to keep the weight off long term. And I'm trying very hard to spend a minimum of 1 hour, maybe 2 hours, especially on the weekends. I'm trying to get to that magical number of 10 to 14 hours of really significant exercise, and high intensity exercise. Interval training can be helpful too as well. So going for a walk is the starting point, but if you're not prepared to build muscle, and one of the things is that there was one patient, and he's just a great squash player. His hemoglobin A1C was 13%, and he's a young guy. I said, "Oh my God, you're in trouble." But one of the things that he did is that he built muscle and he played squash 2 hours most days of his life, and he's controlled his blood sugar with very little medication. I didn't think that was possible, but it just shows how you can do things and take initiative. I want to put him on medications. Initially, he's on some medications, but he's on a fraction of the medications I thought he'd require. So always a lesson about these sorts of things. Tell us more about the different food choices here.
Yeah, so expanding more on the glycemic index. So this infographic is showing like the glycemic index numbers for a bunch of different carbs and other foods.
So
So
glycemic index is between 0 and 100. Can you explain that a little bit to us at all? Do you understand that at all? Okay, help with that.
if you want to explain that, that'd be great.
Okay, so it's basically simple sugar has a glycemic index of 100. Basically, all the white sugar, white flour gets broken down very quickly into to sugar. And you can see that one food I really like is oatmeal, but the instant oatmeal is really not a great choice. It has a very high glycemic index. So rice, white bread, you're killing yourself. One of the things is that I love to go to Red Lobster with my daughter, but they have these beautiful rolls with white bread. That's the bad news. The good news is they're soaked in butter. So my glycemic index might not go up as much, but I'm not putting healthy food into myself. So if you look, is that on the bottom there, those legumes and nuts and things of that nature. So I'm trying to make sure I have beans almost every day of my life, and you can see that their glycemic index is a lot lower. Or watermelon may have a higher glycemic load. It's index. It doesn't have low glycemic load because it's mostly water. So you can look at all these different foods here, and you have to sort of stare at these foods that you look at, and the best part of the baked potato from glycemic load or index is to have the skin and put in the fridge for a while and then read it later. But there's so many things you can do to change your diet. Any pros from anybody? Like, for instance, I just have like frozen blueberries. I just take them out of the out of the freezer, keep them cold, gives me a taste. I add chia seeds to it and flax to it, and I put a few chocolate chips in it to give it a little bit of flavor, and put a little bit of milk, either skim milk or oat milk, and just eat it cold. And so that's great. So I'm just trying to, as you point, is surround my sugar with other foods content in there. Any thoughts from anybody? Anything else? Anybody?
Just want to add, I've seen that, so even if you want to have carbs, you mentioned oats, having it with blueberries, having it with, blueberries is not protein, but I was going to mention having it with protein and healthy fats, not just having it pure carbs, speaking from the glucose spike idea, not that it's bad, but above a certain point, as we said, about 10, that's the insulin resistant stage. It would kind of soften the blow. It would soften the spike when you mix it. So combine that with all these ideas here, some activity after a meal. We mentioned walking, push-ups, squats, just some. I wonder if there's a trial of 30 seconds of squats on glucose spikes. I think we should have. I think there is. I think it would have. Yeah, I think it would have been amazing if we had that here, just to show that you don't have to go on a 20-minute, 30-minute walk to make sure that your blood glucose is under control. Just a little bit of activity after a high glycemic index meal can help reduce that spike by a certain percent. So just
you're
keep
absolutely
these
right.
tips in mind.
There is some data doing squats, push-ups, and other high intensity exercise for bursts. Some people call it exercise snacks.
Yeah.
For your blood sugar. It's a great idea. So and you bring up the issue about dairy. So one of the things I'm trying to do is have more fermented dairy. Greek yogurt I'm adding to these sorts of things. I'm trying to get rid of all my liquid calories. So my liquid calories that I have mostly is that I'm having some degree of milk, mostly skim milk. I'm trying to mix that with other things. I'm trying to get rid of all the diet pop, all the juices, and orange juice is not a health food. The only time you should have orange juice is a little sip when you're taking iron to increase the absorption of iron. But and all the real fruits and vegetables and and fat is not necessarily a bad name if from I'm trying to avoid a lot of saturated fats, but I'm also trying to limit my calories. And so what I always remember is a glass of skim milk is 90 calories. A glass of regular milk is twice that amount of calories. So and you don't feel fuller after that. So you have to pay attention to that. I like now almond milk right now. It's only 30 calories, so it gives me some things. And I'm trying to get more nut milk, soy milk. I love the almond milk. I'm sorry, I love the oat milk, but I'm realizing it's more of a simple sugar. So I'm trying to get I'm cutting out my oat milk at this point in time, replacing it with soy and almond milk. So I'm trying different things, and I'm always and I'm having a lot more fish in my diet, and some days I'm wonderful, other days I just fall apart, and but you just start again tomorrow. That's okay. Is that and you remind me maybe I should do some squats after I have dinner or something like that, or yeah. Thank you for sharing that. Fermented food is also one of the things that the microbiome, all the microflora, there are many bacteria that will actually chew away some of these carbohydrates before they get absorbed. And I haven't so I'm trying more sauerkraut, more sourdough bread, for instance, because I love bread, and I'm just trying to eat as little as possible. It's whole wheat, real sourdough bread is really nice, and add some vinegar to everything, as you point out. Apple cider vinegar, any vinegar is actually quite good. Tell us more.
Awesome. So we're going to talk about what the randomized control trials show about CGMs. So next slide. So we're going to be talking about a recent meta-analysis from 2020, pooling data from 15 randomized control trials. It had over 2,461 participants combined with 1,300 using the intervention, which was the CGM or a real-time CGM, and 1,153 in the control group. So these are like the key findings of this systematic review and meta-analysis. So we saw that CGM was associated with modest but significant improvements in key metrics of glycemic control. So starting off with HbA1c reduction. So across the studies, CGM reduced HbA1c by an average of 0.17%, a modest but meaningful reduction, especially in trials focusing on glycemic control. In the trials specifically using real-time CGMs, HbA1c decreased by 0.23%. And that underscores its effectiveness for patients with type 1 diabetes and those aiming to improve overall glucose levels, right? And then moving on to time in range, CGM use led to a substantial increase in time spent within the target glucose range, with an average gain of 70.74 minutes per day compared to the conventional monitoring. And notably, with the real-time CGM, we got offered the most pronounced benefit with an additional 83.49 minutes per day compared to monitoring. Looking at reduced hyperglycemia, we saw the studies showed significant reductions in time spent in hypoglycemia, time below range or TBR. And on average, CGM reduced level 1 hypoglycemia by 27 minutes daily. And these reductions were particularly strong in studies focusing on hypoglycemia awareness, suggesting CGM's critical role in minimizing these areas. And then the last thing I just wanted to mention about this study was glycemic variability. So one major benefit of using CGMs is that it helps reduce the glucose variability. So the ups and downs in blood sugar levels, right? So studies show that CGM reduced these fluctuations by 3.09%, which is important for long-term blood sugar stability and avoiding complications. Next slide.
Well, it's actually, if you just backtrack over here, if you can look at it's if you're going to use these things to control your hemoglobin A1c, it's pretty shitty. You're not doing a really good job. It does help for why the Ontario government allows it only for patients on insulin is because it's to pick up serious hypoglycemia, so you don't pass out, break a hip, hurt yourself while driving a car and things of that nature as well. But for the, I would argue that the key. These continuous monitors should be done much earlier in people who really are interested in your health. If you're not interested in your health, why watch yourself die? If you're interested in helping, change outcome, it makes a huge difference. You can see, like, if I, for breakfast, instead of having, like you know, oatmeal with some raisins and some brown sugar. Okay, now I'm going to have I put some frozen blueberries. I'm going to add some chia seeds, some little bit of flax, and a couple oats, and I'm going to throw in some Greek yogurt. Man, what a difference in my blood sugar! And I'm going to change my diet, but I find that we're getting too passive, and so I think this is a wonderful opportunity. Thank you for showing this, because by giving people information really changes behavior. It's a starting point. And I think we all know what we're supposed to do. You know, half our plates are vegetables. We probably can increase our protein intake, especially as we get older. We can add beans to our diet. But you know, oh, I love that bread. I love eating at nighttime. I love that snack, midnight snack. But when I see these results, I'm changing. I know what's going to happen if I don't, and so do you. Thanks. Save us more. Sorry for preaching too much, but I think this is important.
Yeah, just want to go over some key considerations to conclude everything. So number one, don't base your diet solely on the blood sugar in the CGM. Consider other important nutrients and components of your diet that influence your health. And if you want to test how different foods affect your blood sugar levels, test on meals that you regularly consume rather than the effects of simply one food. And again, there's like lack of research on the ideal blood sugar spike after a meal, or if lowering blood sugar is useful for healthy individuals. So just continue learning more about it. And here we have amazing resource, Dr. Mario Kratz, Nourished by Science. You can find it on YouTube. There's a lot of great information on CGMs, blood sugar spikes, and much, much more, which can be very helpful to learn about. And of course, check out our other previous webinars regarding weight management, sugar, diabetes. We have lots of information for you to learn about and get even more understanding around CGMs, whether it be sugar or your blood sugar levels.
Thank you so much, Hisham. Especially this person right here. There's not a lot of evidence-based people, so whenever I do see one, I love to share with people. So please check his videos out. He is quite an academic. Some of the videos that he has, not as long as ours, a little bit boring, but it's exceptional information, very precise, very thoroughly checked and evidence-based, and that's why we heavily use his advice for this webinar over other educators. So just take a look if you have diabetes, if you want a more evidence-based nutrition advice. He also has some videos on weight loss, but he mainly focuses on, he's a diabetic clinical researcher, so that's his focus. Anybody wants, please check out. We also had the Ozempic webinar here. Check that as well. Some reflection for me, I was telling my mom about this webinar, and so I come from a cultural background where 95% of our diet is carbs, and so if somebody has diabetes, it's very difficult to change that lifestyle and adopt a different diet, mix vegetables, etc. We have stews and such where we mix vegetables and protein, but it's really not enough. If you come from the Middle East, rice is a huge part of your diet, so you have to learn how to cook and find some healthy recipes, etc. So there's real life constraints, especially with people who have with families, and you share meals. Different people have different needs, so that's interesting. So having supportive people around is wonderful, because most people eat together and you both need to eat healthy. A lot of people, a partner, for example, they want to make a change. Let's say they're diagnosed with diabetes. Both people have to make the change. The entire family has to make a change that are in the same household. It's more difficult when one person wants to do it alone. Just want to share that personal touch as well. Last thoughts, Dr. Curnew, anybody else? Team, thank you so much for putting the detail in this webinar as well.
You know, Rad, I don't know how you find all these different people. So that I listened to the other webinars from that gentleman there. They're fantastic. I would argue that continuous glucose monitoring should be done well early in life, at different phases of your life, different times. And you know, the data for controlling blood sugar isn't particularly good. Once you have your flat tire, it's hard to rebuild, and I know how difficult and challenging it is. you point out that the broad and direct trial shows you can actually put diabetes into remission in people in the first couple of years of the diagnosis of diabetes. I'll see if I can manage to do that or not, but if not, I'll just go down fighting and trying hard. Is that diets? One of the things I just changed in my diet is that I take egg whites, I take all the vegetables I can find, and what I learned from the weight loss team was that getting bok choy. So bok choy is actually very rich in calcium, and it's really nice. I'm cutting up bok choy and putting it into salads. I'm putting it into soups and things. I love broccoli. And there's just so many things to do. So you don't have to do it alone if you don't want to. In one sense, it is overwhelming. It takes a long time, but is that for the time we have left on this planet, we might as well try to maximize their health and help others. And you mentioned about rice or bread being parts of most of our diets. What I'm learning is that 40% of the wheat production, we're going to probably lose that because they're really they're harvested in areas that have drought already. Same thing with rice. So we're going to actually lose our rice, and we're going to lose our flour production soon, so our wheat production. So we're going to be in trouble. We're going to have to change our diets because those foods may not be available. I learned that maybe peaches will no longer be available because of global warming as well. This has actually affected harvest productions and things of that nature. So we're gonna have to change. I know like almonds like lots of water, and that's going to be a problem too as well. So we have to figure out ways to work on the planet. We waste somewhere at least 25% to 40% of our food supply. So I'm trying to waste less and to work in this area here. So I'm working on better sleep as well. And I love these glucose monitorings, and put that weight 100, and that is that the people from Libre were really quite helpful today. I made a lot of mistakes on how to use that Libre device, and so I'm gonna learn how to use that better. And basically, because there's 3 devices that malfunction, I'm not sure how much of it's my fault, how much is whatever's fault, but they're actually going to replace them. And I called the weight 100 number. I found out from our mindfulness group, is one of our patients uses the Libre 2 devices, and he actually buys them on Thursdays at Shoppers Drug Mart, gets a 20% discount. And so there's so many things to learn from, and all the people around now. I tend to overdo things in some way, and I want to thank the team for a wonderful production. And go back to that slide about the patterns of blood sugar if you can. And I want to show you some things here. And actually, if you just go to the one with that blood sugar, the different colors there, where your range is, I think.
One sec. That's very important ones. So there's this one, and the
Yeah,
A1C conversion. This one.
No, yeah, that's A1C conversion. It's a really good one to keep an eye on.
Yeah.
But go to the other one too that you just passed over here. That's the one there. I love this one over here. This reminds me that where your blood sugar should be. 3.9 to 7.8 should not go above 10 if you can. And realizing that there's so many ways to look at these things. And if you can show the patterns of blood sugar and normal and the spikes as well. I love this slide here. This tells us, what's happening to it. So you can have the same hemoglobin A1C, but you can see the different spikes and the acceleration and the length of time you're spending in different zones. Part of it, you can change that by changing your composition of diet. So I'm trying to increase protein in my diet, have more vegetables. I do have sweet tooths, and I do eat at nighttime. And I don't exercise before I go to bed, so I have to think about that. So tonight I'm going to try not to eat too much more the day. I know I have some salmon at home. I have a little bit of salmon, and I'm going to take the dog out for a walk tonight before I go to bed, or do some push-ups or something. And I'm going to try to get up for 5 o'clock tomorrow morning, go for a swim, go to my wife's yoga class, and be at the clinic for 7 if all goes well. A couple more phone calls to make, but that's I'm trying, and some days I'm successful, some days I'm not. And don't be hard on yourself, but don't give up, and don't wait to see the dietitian. I find that ironic. Is you're the dietitian, you're the master yourself. Get one of these monitors, and if you want to get one of these monitors, we'll show you how to use them, and we'll help you use them, and hopefully we can learn from each other. I learned a lot. Thank you so much, everybody.
Thank you, everyone. Thank you.
Have a great night.